I shadowed her one-on-one. Then she would let me do like 25% of things alone, then 50% of things alone, then 75% of things alone. Then she would be out of the room while I would do things, and she would just review it. And this preceptorship brought me to a whole new level. I went from working in the outside rooms of the ER into managing trauma rooms. And this is all in like a 6-month time frame. She moved me just by precepting me well from being ashamed and feeling incapable to feeling very capable, having support, having a preceptor that I could ask any questions I wanted to. And she told me up front, you ask me any question. Every question is a good question. I'll answer that question. I will never make you feel dumb for asking me a question. Ask whatever you need to. That woman taught me so much, Sharon, that even today, she and I still communicate and we talk because she taught me so much. And that is also what led me into wanting to teach and mentor others and precept others, because I saw what it's supposed to look like. So what can we learn from my first preceptorship to my second preceptorship? Something that I did not know was that I should have been speaking up for myself. I should have been saying, hey, this does not work for me. This preceptorship is not a good fit for me. Hey, my precept is very inconsistent. Is this part of the program, or am I supposed to be with the same preceptor every day? This precept is passing me off to friends who I'm not comfortable with and I don't know them. What should I do? I should have been asking my charge nurse these questions, but I was a novice. I didn't know. I did not know that I should be asking these questions. I should have spoken up to my charge nurse when I was told directly to my face as a new RN what was said to me by Amy, that, hey, this is very hurtful and this is not how you treat new students. I didn't. I actually started to consider if what Amy said was correct, maybe I'm not cut out for this. If I could go back, I would speak to my charge nurse and say, you should have never repeated to me what Amy said without coming to me with a solution. But you should have never repeated that to me. That she did not think I was capable. That I could not be a good ER nurse, because she really just doubled down on what Amy said and broke my heart even more. But I didn't know to speak up for myself and to be empowered in that time. And I'm also from that generation where you just grin and bear it. So even just the generational changes. And it said that nurses eat their young. I really could have been eaten up and eaten alive if God had not provided another way out for me. So let's talk about the preceptorship with Sharon. Open, honest. If I did something wrong, she checked me on it. She taught me the right way to do it. We aligned learning styles, the shadowing, the hands-on practice. She debriefed me on patients, and the debriefing was very important. We had communication, we had boundaries. I had an opportunity to seek help. She taught me not only the medical clinical side, but she also taught me the political side, how to uphold yourself in the professional side, how to uphold yourself when there's drama on the floor. Stay out of it. That ain't got nothing to do with me. How to uphold yourself as a professional. You enter each room as a professional. You leave each room as a professional. You keep your promises. If you tell a patient you're going to bring them water, bring them the water. You're kind. You're loving. You educate as you go. And she educated me on so many things. And it was so beautiful to be able to ask for help when I needed it. Let's go back to Amy for a moment. I expressed that Amy crushed me. This was the most difficult part of my nursing career, and it was very, very young. I became anxious on the job, depressed on the job, not wanting to go to work. Again, that word incapable kept like ringing in my ears. Not cut out for. That should not have been done to me. But here's a good thing. What was said to me to destroy me, what was said to me, even it may have not have been intentional to hurt me, but it definitely hurt me. But it also created the foundation for resiliency to blossom from that. And the resiliency did blossom. You see, I'm still here today doing what I do, loving it. I ran into Amy again about 10 years later. I was preparing to go to MP school, and I was looking for just a PRN ER job as I was going into MP school. Because this would have happened with Amy around 2001. And I ran into Amy in 2014. I knew her face immediately. And when I saw her, and I was really just walking in for the interview and trying to find administration so that I could, the ER director, so that I could start the interview process. And I looked at her and I said, "Excuse me, is your name Amy?" And she said, "Yes." I said, "How are you today?" I said, "My name's Cashoyna." I said, "I worked with you about 10 years ago." She looked at me, she said, "Oh." She didn't even remember me. Didn't even remember me. And in that moment, I was so proud of myself. I was proud of myself because, Amy, you tried to destroy me. Not tried, let me change that word. Amy, you said something that could have destroyed me about 10 years ago. I'm still here. Not only am I still here, but I'm moving up to the next level in my nursing career. What you said to me did not destroy me. And it felt so good to be able to look her in her face and see her again, and to be seen by her again, even if she didn't remember who I was. I remembered who I was when she said that to me. And I knew who I was in that moment, meeting her again. And I looked at her and I said, "Okay." I said, "Nice to see you again." I had no bitterness towards her. I had no unforgiveness towards her, because she helped to make me better. Like Neo say, you make me better. She made me better. That trial made me better. That challenge made me better. So all that to say, Amy, the same Amy that almost destroyed me, did not even remember me. She didn't even remember me. And honestly, once I started precepting with Sharon, I didn't really pay too much attention to her and the voice and what she said either. Because in my growth with Sharon, I'd grown a resilience and grown beyond that moment with Amy. And I also decided I will never be the person to destroy someone's confidence in that way. There's so many other ways to address needs, so many other ways to educate individuals. And again, Amy may be one of the reasons that I enjoy coaching and mentoring and precepting. I had a few names in my head about Amy back in those days. Not anymore. I'm grateful for Sharon and her observation of my needs. I'm grateful for my mom and her prayers. I'm grateful to God for allowing me to make it through that moment. And I'm proud of myself. I'm proud of myself for giving myself the chance to be great, to become. It's been a little heavy because it brings me back to that moment. Thank you for listening and allowing me to share. And if you're in that situation, remember the tips to speak up for yourself. This is your life, and you deserve to have what you need to be successful with the right people around you.